Hello, everyone. My name is Deepthi Jose from Christ Deemed to be University, and today I will be presenting my paper Emotional Abuse and the Pandemic in India Implications for Policy, Research, and Practice. This ongoing pandemic has made and is making history. It will be spoken for generations. Its impact on all avenues healthcare, education, employment, home environment, human relationships, and even the lives of our pets and animals. It is not the rising number of cases in the country or around the world alone, but its repercussions on all aspects of our lives that leave us feeling overwhelmed and fatigued. I need to mention that this paper is a conceptual paper that talks about different aspects of emotional abuse and how it is perceived, especially in the Indian society. I also stress on different policies and regulations in India that attempt to safeguard the rights of our people. COVID 19 has shed light on our relationships at home. Though the lockdown provided us time with our loved ones, it also gave us time to bear our differences. Newspapers and magazines spoke about conflict, separation, rise in divorce cases, and domestic violence, and the not so subtle emotional abuse in our society. Now, emotional abuse goes unrecognizable as it leaves no physical scars, further delaying the individual from seeking help at the right time. It is interesting to know if the effects of emotional abuse is it similar to physical and sexual abuse. Is it the same or worse? What literature points out is that it's very difficult to compartmentalize emotional abuse separately. If you look at it, physical, financial, and sexual abuse can happen independently, but all of them have one thing in common emotional abuse. Though India has been observing a massive spike in the rise of domestic violence in 2020 due to the restrictions imposed to curtail the effects of the pandemic, cases by men and women are still underreported. Statistics show that only 1 in 3 women report that they have ever experienced abuse. Statistics on men and their experiences of abuse are yet to be recognized. Sensitization of the public on emotional abuse could assist individuals to recognize and seek help to formal institutions to provide them any form of assistance. Now, before delving into emotional abuse, it can be very confusing since it is known by many names, but it is a good start to understand what abuse really means. To make it really simple, abuse is away from the norm, or more than the norm, more than what is necessary, and that which can create harmful consequences or effects on an individual's well being. Now, emotional abuse is typically a non physical act that is done from one person to another to which results in them making them feel helpless or unworthy, a sense of self doubt, and they tend to question themselves and who they are and what they can and cannot do. Now, emotional abuse falls under a continuum. On one side of the continuum, the person can be extremely demanding and threatening. On the other side of the continuum, they can be very withdrawn and avoidant. Even though both are different forms of displays of emotional abuse, they both seek to bring the individual in their sense of control, and it results in that person feeling helpless and withdrawn, unsupported, and having a questioning sense of self. Now, according to the National Family Health Survey, the fourth and the fifth edition, it indicated that 25.3% of the urban population and women experience emotional abuse, and 34.1% of the rural population of women. Among 31.1% on a whole that experienced abuse, they were each compartmentalized as the following: 27.4% experienced physical, 12.7% experienced emotional abuse, and 6.7% experienced sexual abuse, with 3.4% of women experiencing all forms of abuse. What really caught my attention was the change in the definition of spousal violence, which I will get more in detail in the further slides. The NFHS also stated that there were multiple factors that contributed to emotional abuse. Here I won't go in depth, but some of them indicated that women who were older, widowed, separated, or divorced, employed women, women who used substances or had difficulty conceiving, at some point of time, as per the survey, they became more vulnerable to the experiences of emotional abuse. Now, due to the restrictions imposed during the COVID 19 and the stigma of reaching out to professionals, it really reduced the chances of individuals and couples seeking professional help. Yet, the seeking of online counseling or therapy session was possible only to a small group of people. Women could be afraid of filing a complaint due to the fear of being heard or the fear of harassment, and men felt embarrassed or dismissed to explain their position of being abused to formal authorities. The National Commission of Women received 23,722 complaints for the year 2020, which is the highest ever in 6 years. 7,708 women received the Right to Live with Dignity clause, which takes into account of emotional abuse. 5,294 complaints were regarding domestic violence as well. SIF, or the Save Indian Family Foundation, an NGO supporting men's rights and welfare in New Delhi, reported 1,774 cases from 22 states since the lockdown. Distressed men have called helpline numbers to assist them during feelings of helplessness and confinement during this time. With these numbers, isn't it safe to say that emotional abuse is predominant in our country and needs to be further researched upon? Now, providing accessibility to help. Well, there are several organizations that have been established to safeguard the rights of women, and quite a few for men. But do these helpline services really reach and help everyone? As of 2018, a digital gap does exist among men and women, witnessed more in the rural areas than the urban, with 45% of women owning phones compared to 76% of men. Now, with difficulty on how to operate these new age mobile phones properly, how many can actually file a complaint? Or the better question, how long does it take till the helpline service actually revert back to your help? Now, more helpline services plus adequate action is yet to be taken to reach the number of men and women requiring assistance, and also to provide reassurance and necessary help will be available at the rightful time. Individuals can be given referrals to counselors for their mental health, social workers, for shelter, employment opportunities, and support groups to interact with other survivors that can help encourage them to feel better about the situation. Now, this can be challenging. If the process of getting help is too overwhelming, individuals will rather stay in their abusive relationship than to ever seek help. Considering the impact of emotional abuse on an individual, the impact on their children and family witnessing this trauma is much more. Support from women organizations and evidence based measures on addressing emotional abuse can really instill hope on these individuals. It is of dire necessity to gauge the reasons for underreporting, to address them, and to encourage individuals to seek assistance instead of enduring such presenting circumstances. Now, the spousal violence was incorporated in the National Family Health Survey, the NFHS 3, which was brought about in 2005 2006 due to the rising number of cases among married couples in India. This questionnaire included questions of physical, sexual, financial, and emotional abuse as well. Now, though these questions remained in the following three editions, the fifth edition explicitly states that spousal violence includes only physical and sexual abuse. Even with the rising number of cases in India, isn't it important to delve into the why and most importantly, what can be done about sexual abuse? Sorry, emotional abuse? Ironically, the questions pertaining to emotional violence are only asked to women. With the increasing number of cases of men being abused, should we not include them in the survey as well to get the actual status in our country? The public needs to be made aware that violence is bidirectional. Men not fitting the characteristics of what is masculine is not a valid reason to be dismissed, and it becomes all the more necessary to alleviate their distress in a healthy manner. The complaints from both the sexes need to be taken more seriously and genuinely inquired to serve rightful justice. This also calls the need for gender neutral laws. It is necessary that women feel protected and empowered. At the same time, men feel protected too. At present, the numbers show a completely incomplete depiction of our country and needs to include the statistics and the well-being of men, unmarried couples, the LGBTQ community, as well as those in live-in relationships. It is interesting to observe that as per the review on emotional abuse in the last 2 decades, the list of factors that increase the vulnerability among people to emotional abuse are the same factors that have been reported in the following editions as well. This will help researchers to identify target groups for the screening of emotional violence, which would help individuals get the necessary help at the right time. It is crucial to identify these signposts of emotional abuse to create awareness for victims as well as to recognize these symptoms. Adequate and as immediate as possible, consequences for those who violate or take advantage of the law must be taken to reduce the incidences of emotional abuse being repeated. Most people may find loopholes in the system, or that the long process of a consequence for their action can make people feel very deceived and disappointed by the system. This slow process can make people not want to go through the hassle, and again, compromising what might be right for them. With gender neutral laws and efficient helpline services, support groups can be created for men and women to be able to share their experiences and be reminded that they're not alone. This support can reduce feelings of isolation, helplessness, and instill hope that their circumstance is temporary. It could provide a space for them to process their experience as it can have a long lasting impact on the view of themselves as well as their relationships. It can be thus concluded that gender roles and perception of marriage and relationships has taken a swift turn over the last few years, and appropriate steps need to be taken ahead to ensure stability among families. It is necessary to develop appropriate intervention and precautionary measures that could keep individuals informed and to practice better lifestyle choices to enhance well being. Such measures can help in aligning expectations between individuals and families. Couples will learn to adapt and cope with their environment as well. And this brings me to the last of my presentation. Thank you so much for making time and hearing me out on my views on emotional abuse as well as the policies available in India. Thank you so much.